Good afternoon. My name is Karen Herran, and the research I will be presenting to you today is the culmination of my undergraduate thesis work at the University of Maryland, Baltimore County. The spring of 2021, I graduated with an individualized study degree in global health considering environmental factors. Currently, I'm a first-year doctoral student at the University of South Carolina's Arnold School of Public Health, and I'm earning my PhD in health promotion, education, and behavior. According to the Institute for Economics and Peace's 2020 report, up to 1 billion people may become climate migrants in the next 30 years. Imagine 1 out of every 8 people you know having to move because their home is totally destroyed by environmental phenomena. Where will they go? How stressful will their sudden relocation be? What happens when those affected by climate change are forced to migrate yet lack support for recuperating their mental and emotional well-being? Will environmental migrants receive support for their mental health along their journey? Or will the mental health needs always be overlooked? Scholars have applauded the increased research efforts geared towards better understanding how undergoing climate migration and physical health is gradually being explored more and more to improve quality of life for climate migrants. Yet investigation of the mental health experiences is scant. Given both the limited literature on climate migrants' mental health and how the majority of publications focus solely on populations in Pacific Island countries, Bangladesh, and Africa, my mentor, Dr. Buehler, suggested to me in 2019 the formation of this study in order to characterize the mental health experiences of climate migrants relocated to Maryland in comparison to other forced displacement migrants in the state. Please note that I'll be using the terms climate migrants and environmental migrants interchangeably to refer to those who have migrated from their community due to environmental threats, such as natural disaster, or those who have relocated due to climate change exacerbated weather events. I first started the project in January 2019 when I began the literature review deliverable and drafted a qualitative interview guide with Dr. Buehler. From there, I obtained IRB approval, recruited study participants, conducted in-depth interviews and M3 mental health screenings, analyzed the data, completed project deliverables, and recently presented this work at my undergraduate institution's research conference. This study has truly been exhilarating. Toward knowledge, this is the first analysis that explores how the mental health of environmental migrants, specifically in Maryland, can be best supported in comparison to the needs of other forced displacement migrants. Admittedly, the sample size was small. There were more female than male participants, and social desirability bias may have affected qualitative data collection. However, both participant groups were the same size, 5 participants per group, and the technique of individual interviews minimized peer norms influence. The most critical takeaway is that whereas forced displacement migrants varied in mental health scores, all 5 environmental migrants demonstrated mildly concerning or moderately concerning levels of mental health symptom burdens. For context, 4 of the 5 environmental migrants were from Puerto Rico. The Puerto Rican environmental migrants shared they never sought mental health support and that their overarching regret was their tendency to suppress emotions. Conversely, all forced displacement migrants shared they visited mental health consultations multiple times. Forced displacement migrants stressed the need for cheaper and more collectivist-oriented mental health services. Environmental migrants underlined the stigma of mental health conversations and the need for 1, more non-judgmental spaces for mental health discussion, and 2, more mental health education, explaining that these 2 strategies would remove the shame surrounding reaching out for mental health support, thereby allowing psychosocial healing to occur. Given the predicted increase in environmental migrants and their more fragile mental health conditions, medical and humanitarian organizations should intentionally strategize mental health education and create opportunities for environmental migrants to discuss mental health with one another, taking these recommendations seriously. From this data analysis, we developed a scientific manuscript that will advance academic discussion on the nexus of migration and mental health by reporting project results in an open access journal. We're also developing infographics for mental health counselors trained by the Maryland Department of Health Center for Global Migration and Immigrant Health. These infographics will disseminate data results and analysis in a more succinct and practical format than the research article. I would like to thank my UMBC professors and mentors for their support and our study participants for their valuable time, insight, and trust in partaking in this project. Thank you very much for coming to my presentation. I now welcome your comments and questions. Also, please feel free to scan the QR code in the upper left corner of the slide to connect with me further on LinkedIn.